Morning. I'm privileged and pleased to be with you this morning for a very brief time. I apologize in advance. I had an earlier engagement, so I'm going to have to leave, and I wish I could stay the whole day and listen and learn, but I wanted to come by and say hello on behalf of the Department of Community Health. But the most important thing I want to do is to say thank you. We could not do what we do. There could not be public health without you and without what nurses do. And I want you to know that I recognize that, and my main goal this morning is to come and say thank you. For example, we could not have responded as a department and as a state to the H1N1 pandemic that is now winding down without your work on the ground, in the trenches, with the people. And as Commissioner of Community Health, what I want to try to do is to provide a direction and an infrastructure that will help you be successful in what you do. Of course, you've all probably been aware of the transition that's taken place over the last year with public health, formerly being the Division of Public Health at the state level, being in the Department of Human Resources, and then by legislation last year coming out into and moving over to the Department of Community Health. There are a lot of bureaucratic and administrative things that had to take place to make that happen, but in the midst of all that, you are the ones who are providing the care and doing the things that have to happen on a day-to-day basis while the state is doing what it does at that level in Atlanta and at 2 Peachtree Street downtown. But the real work and the real caring and the real service happens where you are, and I want you to know we recognize that and we appreciate it. And what I'd like to try to do as Commissioner, working with Dr. Francois and working with the other members of the Division of Public Health, is to do things at an administrative level that will make your job easier. And I want to be open, I want to be accessible, I want you to feel like you can talk to me, that you can come see me, that you can send me an email, that you can call me, and that you can tell me what you are experiencing. If it's a good story or a bad story, I will listen. And I tell people, and people always are surprised when I say this because they say, well, why are you a lawyer? But I like to say yes to people. I like to find a way to say, yes, we can do that. And if the answer has to be no, I like to find a way to say, well, why? Why can't we do that? And are there alternative ways that we can try to get to the same result? That means different things for different areas, and for public health nurses, that may mean many different things that it might not apply to for other parts of what I do. But I know that you provide care and service in all different settings across the entire spectrum of public health, from the county health departments to the correctional facilities to the emergency disaster shelters, and that you work with a broad range of people all across the spectrum to provide the care and to improve and increase the public health. I know you're going to hear some about this in a more detailed way from Dr. Francois, but when you get down to the end of the day, past all the policies and past all the procedures and past all the things that it takes to run a department like the Department of Community Health, and even to operate a division like the Division of Public Health, when you get right down to it, the aim is to improve the public health of the people of Georgia. And I know that we are behind in some respects. We are at the low end of some indicators with regard to public health. And so our job is to try to find a way to raise those. And you know more than anyone how we could do that. You have ideas, I'm sure, about how from any one particular facet of what you do, how you could do it better, how you could help result in improved public health, how the outcomes for patients would be better. And I want to try to create, and I feel that we can do this, a way that you could communicate that, a way that your ideas can be heard, a way that your value can be acknowledged, and we can not only talk about ways to improve, but we can actually do things. And with the help of our federal partners, the CDC, and with the help of the different federal agencies that provide grant money to the department, but most of all, with your individual efforts and where you are on the ground, that we can work to improve public health. So that's all I really had to say this morning, and that's all I wanted to do was to have stop by for a very brief moment and say thank you. And I hope that you will take me up on my offer to talk to me, to communicate with me, with Dr. Francois, and with the other public health folks, and help me learn and help me understand how I can help you. So thank you very much.